As you know, there's been a lot of things going on in Congress and a lot of changes that are top of mind with everybody right now within healthcare. We also recognize that costs are very, very high, and people are looking for ways to be able to keep a loved one safely at home, but they might not be at a point where they actually need the full-scale services of having a caregiver come in on a day-to-day basis. But certainly, there's some big opportunities out there to avoid going to the emergency room or having a rehospitalization. So about a couple of years ago, I saw a press release that came out from GE talking about an alliance that they were creating with Intel. And their focus was going to be on sort of trying to revolutionize the whole world of telehealth and making it more available and accessible to people, particularly those that have chronic diseases, things like congestive heart failure and COPD and hypertension and diabetes, and things that are very, very prevalent out among our entire population. I reached out to some of my contacts at GE that I used to work with, and we've been successful in putting together a relationship with them to be one of the first home care companies in all of North America to be able to offer a telehealth solution that's been co-developed between Intel and GE Healthcare. This allows people, based on directions that we receive from their physician, to be able to manage their day-to-day conditions that they have within certain thresholds that their physician wants us to keep an eye on and monitor them within. If, for example, they have something that falls out of threshold, a nurse from within our office can contact them and find out if there's something that's going on in their life. Maybe they had Chinese food last night and we're just seeing an intermittent spike in their condition or something, and it's something where the nurse can decide if we need to have the doctor intervene. So we're doing sort of that first level screening to make sure that it's not just something that's a temporary condition. Maybe they didn't even clean their finger real well when they were doing their diabetes test in the morning, and something simple like that. So we don't have to, send off 911 or, anything crazy like that. But at the same time, on a day-to-day basis, we're collecting the information, we're surveying them based on things that the doctor might be interested in seeing about their condition, and we're capturing that data, and it's getting transmitted up into a secure server up in the cloud. And when they go to have their next doctor's appointment, we can provide the doctor with so much more visibility as to what's been going on within their life from the last doctor visit until the current one. Information that the doctor has absolutely no visibility to today. If, on the other hand, they are having some type of condition, we can help by catching it early on, help avoid either a trip to the emergency room or a readmission into the hospital, because that's something that's very, very costly to the individual, it's very traumatic, and it's very costly to the overall system. It costs a lot of money to put somebody into the hospital or run them through the ER. Also, it exposes them to a lot of other things that they may not already have. During flu season, those types of things, if we can avoid and have a doctor be able to early intervene and treat them from home rather than going through all of that process, a much, much better outcome. I think the other thing that is kind of fun that eventually we'll be able to use this for as well. The device that we work with GE and Intel on also has video conferencing capability. So if from time to time, their doctor wants to just do a check-in call, or they want to talk to the nurse about something, or they've got a question, or they even want to hold up and say, what pill is this? We can do those types of things without requiring a visit into the home, but still have a very, very high-touch, highly visible interconnection with our clients. It's not something that is for everybody, but at the same time, it's something that I really believe is going to help people be able to stay in their homes in a much, much healthier state and have a much higher quality of life than they might otherwise have.